Substance use disorder is compulsive drug taking despite significant related problems. It is diagnosed by impaired control, social impairment, risky use, and pharmacological criteria of tolerance and withdrawal symptoms. Experimental, recreational, and situational use can be carried out without adverse consequences. Dependent use, intoxication, and regular excessive use causes a variety of social, physical, and mental health problems, distinguishing it as a substance use disorder.
The three main drugs perceived to cause a substance use disorder are 1. Methamphetamine, 2. Cannabis, and 3. Heroin. Cannabis and methamphetamine users were 10 times more likely to use weekly or more often than ecstasy and cocaine users.
How's the party?
I don't want to talk about it.
That's what you always say. Do you want a bump then?
Yeah.
Got a bit more than we need, I think. Ladies first. There we go.
The clinical reasoning cycle is a critical thinking process which guides clinical decision making. Clinical reasoning is relevant to alcohol and other drug nursing due to the inherent stigma. Considering the patient's situation is the stage most susceptible to preconceptions and bias. When nurses believe these stereotypes and let it affect their practice, they are committing the clinical reasoning error of ascertainment bias. Another clinical reasoning error that could occur is the fundamental attribution error, which is the tendency for nurses to blame patients for their illnesses rather than considering the other factors that may have been responsible. The second stage of the clinical reasoning cycle, collecting cues and information, allows the nurse to gather more information to understand the illness experience of individual patients and how things are related to one another. For example, in the scenario, we saw how Bonnie had social anxiety at the party. She used cocaine to self-medicate and cope with her mental illness instead of talking about her anxiety to her boyfriend. Hi Bonnie, thanks for coming in today. Could you please update me on what's been happening?
Well, 2 months ago Cameron turned up with this random drug dealer in his car and they convinced me to buy ice. It was actually pretty good, better than coke.
Oh Bonnie, that's quite the uncomfortable situation you were put in. Correct me if I'm wrong, but is there some sort of peer pressure going on?
Yeah, I know he's a bad influence, but I don't have anyone else.
That must be so hard for you. So how much did you spend?
Well, it's pretty cheap considering we used to spend like $1,000 a week on coke. But every time I smoke a point, I just want another one straight away.
That's quite a fair bit of money. How do you feel about working so hard and spending that money on drugs? Also, how is work, by the way?
Not good. I haven't actually been working lately. I had my worst come down yet. I didn't sleep for 56 hours. I locked myself in my room. I felt suicidal and paranoid. I haven't been able to work for 2 weeks.
Oh gosh, things have been quite difficult for you lately. Are you currently feeling suicidal, paranoid, or psychotic at all?
No.
Okay, so it sounds like you're experiencing withdrawals. After you come down, how did you feel?
Just really depressed. Like nothing made me happy anymore. All I could think about was getting more ice and feeling happy that way.
So you'd like to feel happy again. Tell me, how do you perceive your current situation and what would you like your life to be like?
Well, of course I want to be happy. I want to be surrounded by good, decent friends and maybe have a normal job. I blocked Cameron's number because he doesn't even care about me when I'm coming down. He never checks on me.
Good on you. You must be proud of yourself. I know that you must be feeling quite abandoned and alone, but blocking his number is a good thing so you're not tempted to use again.
I'm really annoyed I stuffed up again.
That's okay. Relapsing is normal. On a scale of 1 to 10, how confident do you feel about creating this change to stop using meth and coke?
I don't know, like 6?
Using the same scale, how badly do you want to change?
9.
So what can we do to avoid relapsing?
Well, I could block George's number, but honestly I feel like things will just repeat themselves. I think I need to leave the adult entertainment industry. It's just too easy to get drugs. I'd like to work in aged care.
Oh, that's good of you. Bonnie, if you'd like, I can actually make some referrals for you. A psychologist, so you have someone to talk to. A social worker can help you link in with job services, and then you can get that certificate in aged care. NA meetings are also really good too, so you can make some new friends.
Thanks, I'd like that.
Nice seeing you again, Bonnie. How was the NA meeting?
Yeah, it was really good. I made some new friends and I learned things like how to be assertive.
Have my feelings of substance use influenced my reasoning? Do I have any strong beliefs about substance use that affects my reactions to patients? What have I learnt from interacting with Bonnie? Recovery in substance use disorders is more than the reduction or abstinence of substance use. It is the autonomous, beneficial changes achieved in the personal and social aspects of the person's life.
Substance use disorders can negatively impact an individual's physical and mental health, their relationships, and their work and financial situation. with all these aspects being unique to the individual and the substances being abused. Without the ability to hold a job or have enough income to meet the cost of their substance cravings, the individual may commit theft in order to sufficiently meet their addiction, stealing even from family members. They may find themselves homeless or caught up in the justice system, a cycle that is difficult to break without treatment. The intoxication and withdrawal phases of substance use combined with the disinhibition can lead to child neglect, irreparable breakdown of personal relationships, and family violence. Family members may also find themselves facing stigma and prejudice by being simply associated with the individual with a substance use disorder. In the community, emergency responders may have to deal with drug overdoses or situations such as drug-induced psychoses, causing risk to the public. Children may find themselves with needle stick injuries by simply picking up a discarded syringe, or may be traumatized by witnessing unconscious users. Thus, it is not just the individual that is impacted by the substance use disorder.